Imagine breathing in air, just regular air, and from that single breath, a deadly virus enters your body. No bite, no visible wound, just air. This is the reality of Hantavirus, a disease so stealthy, so dangerous, that by the time most people realize they are infected, it may already be attacking their lungs or kidneys. Today, we are going inside one of nature's most deadly secrets. We will explore what hantavirus is, how it spreads, what it does to the human body, and, most importantly, how you can protect yourself and your loved ones. Welcome to this educational look at hantavirus, a silent killer from the wild. Hantavirus is a family of viruses known scientifically as Hantaviridae that are carried primarily by rodents. These viruses have existed for thousands of years, but humans only began to understand them properly in the 20th century. There are over 20 known strains of hantavirus, and they are found on nearly every continent on Earth, from the forests of North America to the grasslands of South America, from Europe to Asia. Different strains cause different diseases in humans. In the Americas, the most feared form is called hantavirus pulmonary syndrome, or HPS, which attacks the respiratory system. In Europe and Asia, the dominant form is hemorrhagic fever with renal syndrome, or HFRS, which damages the kidneys. Both forms can be fatal, and both are caused by the same silent carrier, rodents. The modern history of hantavirus begins on the battlefields of Korea. During the Korean War in the early 1950s, thousands of United Nations soldiers fell ill with a mysterious hemorrhagic fever. More than 3,000 soldiers were affected and hundreds died. Scientists were baffled for decades. Then, in 1978, a Korean researcher named Dr. Ho Wong Lee isolated the virus responsible. He named it after the Hantan River, where infected field mice were first found. And so, hantavirus got its name. But the world truly took notice in 1993. In the Four Corners region of the American Southwest, where the states of Arizona, Colorado, New Mexico, and Utah meet, young, healthy people began dying from a mysterious respiratory illness. They would feel like they had the flu, and within days their lungs would fill with fluid. Investigators eventually traced the outbreak to the deer mouse, Paramiscus maniculatus, carrying a previously unknown strain now called sin nombre virus, which literally means virus without a name. That outbreak killed more than half of those infected and shocked the medical world. It proved that hantavirus was not just a distant threat. It was alive, and it was here. So, how does a virus living in a rodent get into a human being? Hantavirus does not spread from person to person, with one rare exception we will address shortly. Instead, humans become infected by coming into contact with infected rodents or their materials. The most common route is inhalation. When infected rodents, such as deer mice, cotton rats, or rice rats, urinate, defecate, or shed saliva, they release virus particles into the environment. If these materials dry out and are disturbed, say when you sweep a dusty barn or open a cabin that has been closed all winter, the particles become airborne, and when you breathe them in, the virus enters your body. Less commonly, people can also be infected through direct contact, touching rodent materials and then touching the mouth or eyes, or through a rodent bite, though this is rare. Now, about that exception, in parts of South America, particularly Argentina and Chile, one strain called Andes virus has shown evidence of person-to-person transmission. This makes it unique among all known hantaviruses and particularly dangerous. The key risk factors are simple: spending time in rodent-infested areas, living or working in rural environments, disturbing old or abandoned structures and camping or hiking in areas where infected rodents live. Once hantavirus is inside the human body, it moves quickly and strategically. It targets the cells lining blood vessels, called endothelial cells, causing them to leak. This leaking is what makes hantavirus so devastating. In hantavirus pulmonary syndrome, the lungs fill with fluid as blood vessels in the respiratory system break down. Patients essentially drown from the inside. The disease progresses in 3 phases. The first phase lasts 3 to 5 days and feels just like the flu. Symptoms include fever, muscle aches, especially in the thighs, hips, and back, fatigue, headaches, dizziness, and sometimes nausea and vomiting. There are no respiratory symptoms yet. This is what makes it so deceptive. Then comes the second phase, sudden and severe. Fluid rapidly accumulates in the lungs. Patients experience shortness of breath that worsens by the hour. The heart struggles to pump blood efficiently. This is the most dangerous window. Without immediate medical intervention, death can occur within 24 to 48 hours. Those who survive the second phase enter the recovery phase. While recovery can be slow, taking weeks to months, most survivors eventually return to full health. The mortality rate for HPS is approximately 38%. That means nearly 4 out of every 10 people who develop HPS die from it. Diagnosing hantavirus is challenging. In the early stages, it looks identical to influenza or other viral illnesses. There is no rapid bedside test. Diagnosis requires specialized blood tests that detect antibodies to the virus, and these tests are not available in all hospitals. If a doctor suspects hantavirus, especially in a patient with flu-like symptoms and known exposure to rodent-infested environments, they should act immediately because time is everything with this disease. Here is the sobering truth about treatment. There is currently no specific antiviral drug approved to cure hantavirus infection. Treatment is supportive, meaning doctors manage the symptoms and support the body while it fights the virus. This includes oxygen therapy or mechanical ventilation for patients struggling to breathe, careful management of fluid levels to reduce lung congestion, and medications to support blood pressure. In the most severe cases, a heart-lung bypass machine called ECMO has been used to keep patients alive while their bodies recover. Research into antivirals and vaccines is ongoing, but as of today, prevention remains the best medicine. The good news is that hantavirus is entirely preventable. Since it cannot spread person to person in most cases, avoiding contact with infected rodents and their materials is all you need to do. Here are the essential prevention steps. In the home, seal all gaps, cracks, and holes in walls, floors, and around pipes to prevent rodents from entering. Use metal mesh or steel wool for gaps larger than a quarter inch. Set traps and check them regularly. Keep food, including pet food, in sealed rodent-proof containers. When cleaning rodent-infested areas, this is where most infections happen. Never sweep or vacuum rodent droppings, urine, or nesting materials. This sends virus particles into the air. Instead, wear rubber gloves and an N95 respirator mask. Spray the area thoroughly with a bleach solution, 1 part bleach to 9 parts water, and let it soak for 5 minutes. Then wipe up the wet materials with paper towels. Dispose of everything in a sealed plastic bag when camping or hiking. Do not sleep near rodent burrows or areas with visible droppings. Avoid handling wild rodents. Do not use cabins or shelters that appear to have been rodent-infested without proper ventilation and cleaning first. Store food in rodent-proof containers or hang it from trees. If you have been in a potentially high-risk area and begin experiencing flu-like symptoms, especially with severe muscle aches and fatigue. Seek medical care immediately and tell your doctor about your possible rodent exposure. Early medical attention dramatically improves outcomes. Globally, hantavirus infects thousands of people every year. In the United States alone, the CDC has confirmed over 850 cases of HPS since 1993, with cases reported in 34 states. In Asia, particularly in China and South Korea, tens of thousands of cases of HFRS are reported annually. Climate change is adding a new layer of concern. As temperatures shift and alter rodent habitats and population sizes, the risk of hantavirus exposure in new areas may increase. Scientists are watching closely. Hantavirus reminds us that some of nature's most dangerous threats are invisible, carried silently by creatures we share this world with. But knowledge is power. Understanding this virus, how it spreads, what it does, and how to avoid it, puts control back in our hands. Respect wild animals. Rodent-proof your home. Clean safely, and if in doubt, see a doctor. These simple actions can mean the difference between life and death. Thank you for watching. Stay informed, stay safe,